Hi, this is Gwen doing the week 7 synopsis for chapters 14, chapters 25, and chapter 26. Chapter 14 was on the acutely ill, where we discuss review of systems, including all the diagnosis, medication, psychosocial benefits, laboratory values, and reports were listed and discussed, and system reviews were noted, including mental state, vital signs, nutritional concerns. Prevention was an important factor for the acute care, specifically trying not to have them return to the acute care setting. Chapter 25 was post-acute care, talking about inpatient rehabilitation facilities, specifically skilled nursing facilities and long-term care facilities. The differences in the two sites were discussed. Patient management by the physical therapist was noted with listings of exam and evaluation keys, and noted that fall risk and fall assessment were key in these facilities. The evaluation, what worked and what doesn't work, was listed, as well as interventions and unique challenges to this population in the long-term care facility, including restraints, pressure ulcers, restorative programs. Chapter 26 was on home health. The definition of homebound was reported, the role of the PT in home health, and variabilities of home health environment, specifically to cultural biases, ethnic concerns, was noted of the various and multiple home health documentation that occurs, and some limitations that occur in home health. So the discussion board was on two questions, one about pain in individuals in these settings, and also about social economic factors. So it was noted throughout the theme of best practices, with Michael addressing patients' outcome expectations and education of the patient on potential benefits of exercise, as well as addressing any perceived barriers that the patient might have. Karen discussed intervention based on a behavioral medicine approach to physical therapy that can be beneficial for older adults living with chronic pain. Lauren advised us on adherence to exercise and its link to social connectiveness, participants perceiving the benefit of exercise, as well as program design and instructor and individual behavior with the exercise program. It's also noted that support from peers can provide a great support system for those with chronic pain and make it more engaging in the exercise program. The question on social economic factors was discussed, with noting that public health workers and clinicians need to work together to develop programs and social services that are going to be beneficial to the community. We note that lower socioeconomic status is a risk factor for more medical adverse events and the likelihood of hospitalization. And subsequently, clinicians and public health practitioners can be key resources to our local, state, and national policymakers to make health equities for all Americans, especially those with the greatest social obstacle. Lastly is some references as related to this PowerPoint and those in the discussion post. Thanks again.